here with Brian Horner, owner and director of Fast Track Physical Therapy this morning. Good morning.
Good morning, Neil.
How are you?
Good, good, good.
Yes, today we
me.
are talking about one very important part of the body, our aching feet.
That's right. Foot and ankle pain.
So tell me, what is it that you see the most of lately, and what kind of things are you treating?
Well, obviously we see a tremendous amount of conditions with the foot and ankle, and our bodies are built on top of our feet and ankles, and so when we're in a standing position, that obviously if we're having pain there, it makes a day go pretty bad for us.
Yeah.
So, but we see a tremendous amount of plantar fasciitis.
My husband has this.
Right now?
Yes.
Okay.
Yes.
Come see us.
Yeah.
So it's a condition that's very, very treatable. I would say 5 to 10% of patients ever need surgery for that condition. The plantar fascia is a fibrous tissue on the bottom of the foot. It originates right off the calcaneus here and then attaches up on the ball of the foot, and it gives a lot of support through the arch of the foot. Okay.
Right.
So typically, most patients will complain of pain when they first get out of bed in the morning.
Yep.
And those first few steps are not very good, or not very or painful for them, comfortable for them.
Not very comfortable.
And if a patient's sitting a lot throughout their day, at home, work, or whatever, when they first get up from a seated position, those first few steps are usually painful for them. And then obviously, as the day progresses, typically it'll be more painful as they're standing and walking a lot.
And then that Achilles heel tendon pain,
Yeah.
something you're seeing a lot of too, I
most
think.
definitely. The Achilles tendon is the largest tendon in the body. It obviously attaches the calf muscles down to the calcaneus on the backside. And most patients will have pain at the tendon itself or down here on the Achilles or on the calcaneus where it attaches onto the heel at. So just like any other tendon in the body, it can become inflamed, it can become thickened, and then it elicits pain. Also, you can strain the tendon or the muscle, and then also you can tear it just like any other tendon.
That
and when you tear
sounds awful.
Yeah. So
That
if you tear
sounds
it,
just terrible.
that didn't need surgery, but
my gosh.
same thing, Achilles, just like any other tendon, typically we can fix that in.
Well, how do we fix it? What do we do? I mean, what kind of things can we do for all these conditions of the feet and the ankles? And
exactly, and there are a tremendous amount of different conditions. So I just touched on 2 of them.
Yeah.
A lot of times the peroneal tendons that come down and around the outside of the ankle, those can get inflamed. The posterior tib tendon can come down through here on the inside of the ankle, as well as another condition in this area is oftentimes the tarsal tunnel syndrome, which is very similar to carpal tunnel on your wrist, but it elicits, compresses the posterior tib nerve, and that can cause pain. Pain on the bottom of the foot here, you get metatarsalgia or inflation in that area,
well, you know,
and those types of things. So
the foot bone is connected to the leg bone.
It is. It is. So
Sorry,
it all
in
goes.
there.
I get it.
But it is all connective tissue.
Yep,
and
it
so
is.
really that strength in the calf or the stretching of the calf, the stretching of the ankle, especially women, we wear high heels, right? Do not get a shot of my feet right now. But we wear high heels, and so that hurts. And so stretching, physical therapy with you all. How can we get more information about you?
So, well, in regards to the physical therapy part of it, exercise, we believe in exercise. Exercise is part of it, but what I have found that exercise alone is usually not the answer for it. So typically, we do a lot of hands-on therapy, manual therapy, and that may consist of dry needling or cupping, deep tissue work,
cupping
strapping.
is so popular right now.
We probably find the best results with dry needling of any condition or anything that we provide that way. But all those things, those hands-on techniques are helping to decrease inflammation, increase blood flow to the tissue.
Blood flow.
A lot of times we are doing modalities which help decrease inflammation as well as blood flow.
I've not heard of that. Very
well,
interesting.
modalities would be ultrasound, electrical stem, iontophoresis, those types of things.
Your website, where can we find more information on you?
It's a long website.
Facebook?
Yeah, obviously we're on Facebook.
Awesome.
We're on our website. Look us up there, obviously, and that will direct you to us. We're open from 7 to 7, and we have 3 locations right now. We'll be open in Danville.
Randy, I feel better already.
Yeah, I tell you, can you fix my meniscus? I kind of hurt that a while back.
A lot of times you can help with that, but sometimes that needs surgery, yes.
Well, that's for me Thursday coming up here.
Ooh, okay.
It really
Yeah,
is here, so we're getting a little